said infection control. So first of all, for any kind of like airborne, droplet or contact, every time when we're dealing with the patient, we has to follow the standard precursor. Standard precursor, or we just say the universal precursor. Standard precursor or universal precursor must you has to wash the hand. Simple washing hand, you can prevent the spread of infection. So universal precursor included hand washing and also wear the gloves. Wear the gloves and hand washing is a standard precursor. So before to start any dealings with the patient, before to start any procedure, we should wash the hand. Not only the before, after finish the procedure or after finish the caring the patient, we have to wash the hand, right? So a question sometimes asks how long we should wash the hand. 15 to 20 seconds, right? So it is also important when you answering the board question. So like as an example, a patient has a contact precursor we need, right? In case of the contact precursor, you can wash the hand, wear the gloves, you can deal it. But if the contact precursor with any chance of blood contact or body secretion has to chance to contact, that times we has to wear the ground as well. So standard precursor with wear the ground. So here I'm saying the standard precursor are used to care of all of the client to prevent direct contact with the body fluid. Standard precursor routinely practiced by healthcare provider, right? Standard or universal precursor, I said. So before to go, the standard transmission-based precursor procedure, we must know what are the disease list, right? In airborne, droplet, and contact. So airborne disease. So the pathogen easily can transmit up to certain distance because the particles is too small, the droplet is too small, they can transmit through the air. So the list of the disease is airborne. They are measles, other name is called rubella, varicella or chickenpox, tuberculosis, severe acute respiratory syndrome or such, smallpox, and swine flu or H1N1. So this is the list we must know, right? And this is the disease list for airborne precursor. So if anybody has a airborne disease, right, what we has to do? So if when we give the care for the patient for airborne disease, we always wear the N95 masks or respirator masks, right? And all not only this, basically when you're dealing with the airborne precursor, you have to maintain the standard precursor or universal precursor, means you have to wash the hand, wear the gloves, wear the ground, wear the masks, and these masks must be N95 or respiratory masks. And also you should wear the goggles or face shading. So all personal protective equipment we should wear if the patient are the airborne precursor when we need. So also we has to give them private room and negative pressure inside the room. What about the door? The airborne disease patient, their door all the time must be closed. But in case of the droplet or contact precursor, it is not necessary door should be closed. Airborne door should closed, but the droplet or contact door do not need to close. Door can be open, right? And in case of the airborne disease, the patient movement or transportation should be limited. So if unnecessary transport do not need, so in some medical condition, patient has to go for other department. Like if patient has a tuberculosis is an airborne disease, they has to go from the radiology department for chest X-ray. In that times, if patient need to the transmit, patient must wear the surgical masks during the transport. During the transport, they must wear. So the most important things here for NCLEX board, we must know what are the disease, including airborne. So as I told you, the measles is a airborne disease. They're contagious, right? Contagious, and the sign and symptom patient has a fever, non-productive cough, runny nose, and conjunctivitis. But the skin rash like this picture, the typical sign of the measles. This is the picture we're seeing. This is the skin rash of measles, right? Measles skin rash. Here, sometimes NCLEX would give the picture like this, and you have to tell what it is. It's a skin rash for the measles. So, you know, the measles has a vaccine, right? Measles has a vaccine. So, if we give the measles vaccine, is called MMR, measles, mumps, and rubella vaccine, right? So, varicella is also another airborne disease. Varicella, and varicella, we tailed it the chicken pox. The varicella is a chicken pox, other name chicken pox or varicella. So this is look like this varicella vaccine, and also varicella has a vaccine. It's called varicella vaccine. So now another disease called the severe acute respiratory syndrome. So this virus attacked our respiratory system and causes the sign symptom of respiratory infection, and which is very bad. And another is called smallpox. Smallpox is a blister-like infection all over the body. And last one is called Influenza Pandemic, H1N1, also called swine flu. So the swine flu, smallpox, then severe acute respiratory distress syndrome, varicella, measles, all are example of airborne disease. So droplet precursor or the disease are listed in the droplet. One is called meningitis or bacterial pneumonia, epiglottitis, pertussis, mumps, rubella, Haemophilus influenza type B, group A streptococcus, and diphtheria. This is the list of droplet precursor, right? So if anybody has a droplet precursor, they must need the private room, right? They need the private room. Airborne also need the private room, or contact precursor need the private room because they are infected case. The chance to spread the infection from the client to the other healthy client. So when we assigning the room, right, or when we cohorting the patient, it is very important. Same infection should be assigned the same room. The same infection should be shared the same room. So we have to put the similar precursor together. So we never put a clean patient with a dirty patient. Clean patient, example, a patient came with hypertension. So hypertension will not give the room sharing with pneumonia or MRSA, MRSA, or herpes infection. Like a patient came with a broken legs, a patient came with the pancreatitis. This is the clean patient, good patient. So the clean patient we will not assign or cohorting with any kind of infected patient, right? So need the private room. And also here I said, so droplet precursor, patient affected with the same organism, maybe they can share the room if there are room crisis. Or also we have to maintain the 3 feet distance between patient and visitor. 3 feet distance. NCLEX board sometimes asks a question, droplet precursor communicable. If when you communicate with them, how many feet better to keep? 3 feet, 3 feet distance. And also when we give treatment, marks to be on when working within 3 feet of the patient. And same as airborne, limited transport. If they need to transport for any kind of hematological examination or radiological examination, surgical masks patient should wear during the transport, right? What about the door? So in case of the airborne, door must be closed, but droplet or contact precursor, we should keep the door open, right? So now again, I said the disease list is very important to remember in case of droplet. Droplet precursor, the example is a bacterial pneumonia. So meningitis. So meningitis means inflammation of the meninges layer in the brain, right? Inflammation of the meninges. So meningitis is a droplet precursor. So meningitis patient has a typical feature. They have a skin rash in the tongue of the body, and this is called petechia. Petechia is most prominent sign of bacterial meningitis. Then pneumonia. Pneumonia is the infection of the lungs, respiratory infection. So pneumonia is a droplet precursor. Epiglottitis. This is the epiglottis. When we eat something, epiglottis block the respiratory tract, and food will not go to the respiratory pathway. But when we do not eat and we need to breathing, this should be open. But the problem when inflammation of the epiglottis and called epiglottitis, the respiratory pathway should be closed and patient has a shortness of breath. So epiglottitis is a droplet infection. Then pertussis. Pertussis, other name is called whooping cough, right? Pertussis is a droplet. The sign and symptom of the pertussis, they have a runny nose, nasal congestion, sneezing, and red watery cough, right? So here the pertussis patient definitely is infection. They has to raise the temperature, mean fever. Other is called mumps. Mumps basically the swelling of the parotid gland. This is the infection of the parotid gland. Mumps is a droplet precursor. Other is Haemophilus influenza. Haemophilus influenza, they actually causes infection in the lungs. They are droplet. Other one is diphtheria. So diphtheria is a two types. Sometimes diphtheria causes the pharynx, is called pharyngeal diphtheria, but a droplet. But if diphtheria causes the skin or cutaneous infection, they are contact precursor, diphtheria, right? So, and here I can show you how we have to remember the droplet infection. Droplet, easy way to remember Spider-Man, Spiderman. S stand for sepsis. S stand for scarlet fever or Staphylococcus pharyngitis. And P stand for parvovirus B19, or P stand for pneumonia or pertussis or whooping cough. So they are the list of the disease included the droplet. And I stand for influenza, D for diphtheria, especially pharyngeal, epiglottitis, E, and R for rubella, right? And M stand for mumps or meningitis or meningeal pneumonia, and N for adenovirus. So this is the list and easy way to remember the droplet precursor. The list of the disease, right? What are included in the contact precursor? Like Clostridium deficit. Clostridium deficit can cause food poisoning. This is the pathogen causes the food poisoning or GIT infection, Clostridium. Herpes simplex virus infection. Herpes simplex virus causes cutaneous or genital infection, their contact. Klebsiella pneumoniae. So pneumonia in droplet and contact, but bacterial pneumonia is droplet, but the Klebsiella is the contact. Then MRSA, RBS or RSV. So MRSA, methicillin resistant staphylococcus, right? Methicillin resistant staphylococcus. So methicillin is a medication, antibiotic. So this bacteria does not kill by the methicillin. So they need another generation antibiotic. So this is called methicillin resistant staphylococcus or MRSA. The other is called the BRSA, vancomycin resistant. Vancomycin is a very strong antibiotic. But this bacteria will not kill by the vancomycin. So vancomycin resistant bacteria and causes the contact precursor. We need rotavirus. causes very bad diarrhea. Herpes simplex or called sigellosis, infected pressure ulcer, okay, or all kind of skin infection, are contact precursor like impetigo, pediculosis, scabies, varicella, and diphtheria. Diphtheria is pharyngitis, droplet. Cutaneous diphtheria, contact precursor. Ebola. So Ebola, hemorrhagic fever, bleeding. Ebola is the contact precursor, right? So I said the list of the disease we must know for NCLEX board exam. The contact precursor, I want to recap it a little bit. Clostridium deficit. Clostridium infection causes the GI infection. Patient has a diarrhea, right? So here, herpes, you can see herpes infection, herpes simplex virus, type 1 and type 2. Type 1 causes the skin infection, cutaneous, and type 2 causes the genital infection. Then another one is MRSA, methicillin resistant Staphylococcus aureus is a contact precursor we need. Then varicella zoster or BRE, this is vancomycin resistant enterococci. So this vancomycin resistant bacteria can cause the infection of GIT. Rotavirus. Rotavirus causes very bad diarrhea and patient has a dehydration. So what are the signs of dehydration? We must know, but rotavirus is a contact precursor we need. And any kind of infected pressure ulcer is a contact precursor. So when you give the treatment, you must wear, you must hand wash, gloves, and gown. You must wear. The patient need private room. Also, when you remove the patient room, you have to remove the gloves and gown before leaving the room. Any kind of skin infection, I said, is a contact precursor, like impetigo, pediculosis, scabies, diphtheria, cutaneous diphtheria. So this is the impetigo, highly contagious. And if you not treated, it is easily transmitted and causes the infection of the kidney, impetigo, contagious. Scabies, also contagious skin infection, right? Scabies. And here, the chickenpox. Chickenpox is a also contagious. The chickenpox or varicella, but keep in mind varicella also airborne. Varicella also airborne. So Ebola, the most few years ago, Ebola attacked some of the countries in the world. Ebola hemorrhagic infection. So they causes internal and external bleeding like bloody diarrhea, bloody vomiting or vomiting with blood, right? They have a bleeding tendency like petechia or skin rash. Skin rash, I said Ebola is a contact precursor. So this is the easy way to remember the contact precursor. We say means we, MRS, we, means we. M stand for multi-drug resistant organism. Multi-drug resistant organism. R stand for respiratory infection, is a contact precursor. Any kind of skin infection, as I told before, impetigo, pediculosis, scabies, varicella, and cutaneous diphtheria are skin infection. Wound infection like infected pressure wound or any kind of major skin wound, burn infection, or Infected pressure ulcer, wound is a contact. Enteric infection, GI infection like Clostridium deficit, right? They causes the contact infection. Eye infection like conjunctivitis, viral conjunctivitis, the contact precursor. So this is the basic things we has to know for board.